So along with EHCVS, Voices of Colour and the local NHS, we're really excited to be launching our Ealing Roots and Wings grant programme for Black-led community organisations. This is a grant programme for up to 10 organisations. We are looking to repeat the programme in a year's time, so there will be a further application process in a year for another 10 organisations. And included in this grant programme is a £5,000 grant to support projects, and this can include core costs. There's also will be peer research training for a senior leader within the organisation. And included in this will be compensation for their time in addition to the £5,000 grant. We will also be supporting access to networks, tailored training opportunities as required by the individual and the organisation, and supporting participation in listening circles to address healthcare challenges which are experienced by all communities. So we were running this programme because we know that Black communities face significant health inequalities, such as higher rates of chronic conditions like diabetes, hypertension, and this is all exacerbated by persistent barriers to accessing culturally relevant healthcare. And we know that there's, among some communities, there's a real lack of trust with NHS healthcare services and other sort of services, for example, council services within the area. And we also know that there's other issues like structural racism, which impacts access to healthcare. The Race Equality Commission, which was carried out as a result of COVID and also Black Lives Matters, a report was published in 2022 and recognised that representation is really important in building trust and providing insight. But there is a specific problem for healthcare services, where there really needs to be a clear voice within services from our communities and health leaders who are representative of community. And one of the conclusions that the report came up with was that we really need to be building trust with communities. And we must start that now. We must be listening to experiences of residents and understand challenges and recognise the different experiences of different groups. And we also need to be continually using data and insight and understanding to ensure we are continuing to narrow inequalities. So this programme has been developed in conjunction with so many people, including people, members of Black communities, and with the EHCVS, Ethnic Minority or Minoritized Communities network. And we're really wanting to use this as an opportunity to develop relationships with Black-led organisations in Ealing, and particularly those who are perhaps not already linked into networks. We also want to be able to support your organisations through the grant and through the training opportunities, because we really recognise how important community organisations are for those people that they support, and how that actually we don't always recognise how much organisations such as yours do for the community. And we also want to ensure that your voices and lived experience and those of your communities are actually heard by the people who need to hear. So the decision makers in healthcare forums. The name Ealing Roots and Wings was actually proposed by a Black leader of a community organisation in Ealing, and these were her words in terms of why she came up with the name. And it really reflects the importance of nurturing strong foundations, as well as addressing kind of systemic issues and fostering stronger connections within the community, alongside the aspiration to empower Black leaders and their communities with the tools, resources and platforms needed to thrive, influence decision making and create lasting change. So I think somebody's come off mute. So this grant programme is for small community organisations, charities or voluntary groups in Ealing with an annual turnover of less than 200,000. We're looking for organisations where at least 50% of board members or senior leadership identify as Black ethnicity, and by that we mean African and Caribbean heritage. And we're looking at groups who deliver activity to improve health and well-being. So this includes activity to improve physical health, mental health, but also what we call the building blocks of health and well-being, which is demonstrated by this infographic by the Health Foundation. And reflects what we know actually are some of the really important factors that influence health. So things like the friends, family, communities, and sort of social connections are really important for health, along with good education, skills, good housing, nutrition, employment, and in sort of employability skills, and our surroundings and our environment, all really important. So any organisations which actually influence some of these factors, which we know influence health and well-being, will be eligible. In terms of how this would benefit you and your organisation, well, of course, obviously, aside from the £5,000 grant, receiving their peer researcher training and being a peer researcher means that you can influence the way knowledge about your community is produced and shared. And Indy will talk a bit more detail about what this programme entails. This peer researcher training will enable you to better understand the needs of the communities you work with in order to support the work of your organisation, and also to support future grant applications, as well as obviously support your skills to evaluate your services. You will also be able to link in with networks and forums to share findings and inform discussions and decisions around health and well-being which impact your communities. You will be compensated for up to 106 hours spent on the peer research programme, and this covers time spent in training sessions, undertaking fieldwork, analysing data and sharing findings. And there will also be other opportunities to be involved in other networks, workshops, decision-making forums, etc. We would ask that you engage with our monitoring and evaluation processes, but we're looking for this to be reasonably light touch because we're obviously aware that you will have a lot of other commitments. So there'll be a baseline questionnaire at the start of the programme, and then at 6 and 12 months, there'll be kind of check-ins, identifying highlights and sort of understanding how money has been spent and any kind of benefits that you have experienced from the programme, and feedback on the programme. I will hand over to Indy now, and then afterwards we'll have a look through the application form. So I'm just going to stop sharing.
Thanks, Gabby. Let me just share my screen. Okay, hopefully you can all see that. Can you all see that? Yeah?
Yes.
Perfect. Hi everyone, I'm Indy and I'm here on behalf of Voice of Colour. So we very much are rooted within the borough. Many of our team are born and bred there, and we do a lot of work around addressing systemic inequalities and really trying to create a space to provide local residents and community organisations to be able to lead that, rather than it be shaped by other voices who don't have that lived experience or understanding when navigating those spaces. So we'll be running the peer research programme as part of this. We have run one before within the borough with a cohort of local residents. So it'll be really interesting to be able to co-design elements of this, but also add the learnings from what we've had as part of the previous programme. So all of this has been explained in terms of what the overall programme looks like. And just to emphasise on the point that Gabby made, you'll be receiving obviously the £5,000 grant, but in addition to that, you will also be paid for your time as a peer researcher, which is separate from the £5,000 grant. In order to make sure that you're compensated for your time, taking part in the training and any other work that's attached to this programme. So in terms of the peer research training element of this programme, you'll be given the space to be able to learn more about what exactly peer research is, but how could you use that in terms of addressing some of the health inequalities experienced by your communities that you know and navigate within that space every day. And so it's how could you leverage this form of research, which is community-led and very much lived experience based, to be able to address those systemic issues related to health and well-being with the work that you do. So what exactly is this? So it's more so of a collaborative participatory research approach that involves communities, individuals with that lived experience addressing those issues based on the knowledge and also just living in that space or even working in that space every day. It's a chance to be able to have that space to explore what's important. And you might be already exploring that within your organization or within the work that you're already doing. And so this space is just to bring that together and to be able to provide you with the support tools to be able to hopefully address some of those health inequalities, but also see some change and not just short-term change, but long-term in terms of looking at the system. How do we then be able to create that change where, for example, there's more access to better healthcare services for communities, or even when it comes to funding to be able to do the work that you're doing, which is so essential for community members. In terms of the training, so this is just a bit of an example in terms of what we're going to be running. So we have core 5-day training. 4 of them will be run before you start your peer research program. So this is just giving you an insight in terms of what they will cover. So providing that foundation to be able to learn a bit more about peer research, but also in particular, health inequalities specifically related to the impact on Black communities in Ealing. So what does that space look like? Who is in that space? And what does that systemic aspect look like when it comes to addressing these? We'll be delving a bit more into mapping those community needs and hopefully being able to help you come up with what you want to explore in terms of your research question as part of your peer research project. So hopefully by the end of that 4th day, you know exactly what you're doing, and we'll be there to support you throughout that whole process anyway. So we've thought of it all. You're not alone in this. We will be supporting you as you also explore and learn more about what's happening when it comes to health inequalities as well. So in terms of your peer research project, oh, and just one more thing actually, because we did get a question about the training. So in terms of how it's delivered, so the last program that we did was in person for the 4-day training, and then some of it was delivered online. We're very much open to learning about the cohort that joins in terms of what will be doable in terms of availability, because we appreciate you're working and there's lots of things happening. So we want to make sure this doesn't become overwhelming, but that it complements what you're doing. So we're still exploring formats, but if a hybrid works, then we could definitely look at how we could make some of those sessions online and then hopefully also have that in-person element so you can meet each other as well as part of this program. So as mentioned, the project itself, we don't want to add any restrictions. It's completely up to you in terms of what you want to focus on within the context of health and well-being within the borough itself. So there might be something that you're already exploring or that your organization addresses that you want to explore further, and to be able to then make the case for what needs to change when it comes to improving certain aspects. For example, when it comes to healthcare services for your community. So hopefully this gives you a bit of a guidance point to what you can start thinking about. And that research question is there to simply guide you, because as part of your work, there might be things that, come out new that you didn't realize or knew were there, but would really want to focus on, which is absolutely fine. That's part of that process and learning journey. In terms of the areas of research, so these are just examples of things that have come out from the previous programs we've run, and it might be something similar that you're looking to also explore further as part of this program. So some of those include the role of systemic racism and discrimination, especially within the context of accessing healthcare. the role of community-based healthcare services, and I'm sure many of your organizations are already doing this in terms of creating those inclusive, safe spaces. And there might be something around working with certain groups, for example, young people, carers, older people within the borough. And so it's very much open in terms of what you want that focus to be. And as you can see, there's been a variety of areas that individuals have explored as part of their programs, projects. In terms of program timeline, so this is currently what we've put in place. It might change a bit based on obviously the cohort's availability when they join. So we are going to be keeping a bit of flexibility around the timeline for that. So at the moment, we've put in training days for April, recognizing that in terms of, we know that's Easter holidays might come up. So we're looking at alternative dates to be able to run that. And then there are going to also be some group or one-to-one check-ins available throughout that field work that's taking place over the 2-3 months. And so you won't be alone. You will have that support whilst you're carrying out that research within the community. And then we have a final analysis training. So making sense of what you've collected in terms of that data, those stories, those insights, those experiences, and just in a sense supporting you to go through some sort of thematic analysis and what those actually mean in practice in terms of some of the questions and things that are coming out of this work. And then we do have a project showcase at the moment in September, but obviously could change. And this showcase is particularly important in terms of showing obviously what you've done over the past few months, but also we will have particular stakeholders in that space in terms of advocating for what needs to change and what more needs to be in place to help communities and Black-led organisations be able to do the work they need to do within the borough. And that could be anything from resources to funding to understanding that healthcare services need to be co-designed with the community, not just for the community. So what does that inclusion look like? Yeah. Right. So in terms of your journey, these are some of the things that you hopefully will get out of it in terms of an insight into peer research, a knowledge of community and mapping frameworks, and hopefully capacity building. So in terms of this approach that we're obviously putting forward in terms of the peer research, we're hoping that you could also use that within some of your work and within your projects and what you're doing. And so it is hopefully that knowledge transfer as well. And hopefully an opportunity to be able to embed that going forward. So there's lots that we are thinking that you might get out of this, especially with this approach and putting this forward. And definitely from the last program, we know that it was important for many of those local residents that took part, which has led us to run a train the trainer program as well for them. So hopefully really helpful. I won't go into too much detail because just because of time, but these are just some of the areas in terms of how we're capturing learnings and hope to support you with your own personal development journey in terms of what you get out of it, what you want to learn, but giving that space for you to just have that reflection time and to be able to get what you want out of it as well, besides also supporting your community and the work that you already do in the borough. Just some of the hopefully long-term impacts that come out of this work in terms of building that local infrastructure, so that knowledge base that I mentioned, hopefully collaborative engagement. So you might not know of some of the organizations in the area or community, so it's a great way to connect and link your work. And then also hopefully looking at how you could use this as a way to be able to bring about that long-term change and that people are actually hearing you and that, you know, initiatives that currently maybe exist within the system don't become tokenistic, but really understand the systemic issues that are impacting communities and Black communities in particular within the borough itself. So yeah, the hope is that it can bring real change and it just simply doesn't become a program or training, but it leads to more. So yeah, I think that's all my slides.
Thanks, Cindy. Gabby, if you don't mind going through the application process, then we can take questions after.
Right, so can you see the application form? Hopefully you can. I don't know how many of you have had a chance to have a look at this yet, but Suvi will go through sort of the actual web page itself, but this is the application form that we were required to be completed and submitted to us by the 20th of January. We have the first bit is just around eligibility. So it was those 3 eligibility points and just to answer yes or no. The next part will not be assessed, but it's just information that we require around your organisation, such as obviously the name, legal status, and registration numbers and contact details. And then the application questions here are the bits that we will be assessing you on. So we'd like to understand about your organisation, about where it is based, the activity and work that you do, and how this work improves health and well-being. And then we will also be like you to answer the section around describing the work that the grant will support. So such as if it's supporting a specific project or a kind of specific activity within your organisation, and who would benefit from that. And then what the anticipated benefits to the community will be for you having this grant and being part of this programme. So those are the bits that you'll be assessed on. The next parts are more for our information. So really it's sort of how you intend on spending the grant. And then any additional areas of research that you are particularly interested in learning more about, what your expectations are from the programme, and your ability to kind of commit to in-person training days or particular times. And this is really for kind of so that we can understand your needs and your capacity for the programme. There's a bit here really about kind of linking you in with EHCVS mailing list and other opportunities, and then obviously your declaration here. And as I say, this needs to be emailed to this email address by 5 o'clock on the 20th of January. So I'll stop sharing and hand over to Suvi.
Thank you, Gabby. I don't know if you've had a chance to see the website. I've just popped the URL in the chat at the moment. I'm just going to share the web page very quickly, just so that it's, as Gabby said, we've tried to keep it simple and easy to use. As you saw, the application form is not an onerous one either. You can see the guidance notes in detail here, which can be downloaded, and Indy has put together a document on peer research. If you have any questions, you can email us at development@ehcvs.org.uk. Also to remind that EHCVS is an infrastructure organization providing support in Ealing. So if you need support in completing the application, if you have different accessibility needs or you need it in a different format, please do email us and we'll work with you to make it most accessible for you.